Good afternoon, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. This is your chance to get your COVID questions answered live. You can put your questions directly into the box below. You can also put them on Facebook or Twitter with hashtag AskDrArwady. Today is Tuesday, January 5th. We are starting a little bit later than our normal time because we had a press conference this morning highlighting our second doses of COVID-19 vaccine that were given here in the city of Chicago. So 3 weeks ago, we gave our first doses of Pfizer vaccine to 5 healthcare workers at Loretto Hospital. And then today, we gave the second dose to those same 5 healthcare workers, this time at Norwegian American Hospital. We had healthcare workers from 3 different hospitals, actually, as part of that event, that ceremonial event. All of them are doing very well, as am I. I've only gotten my first dose of vaccine, but when I had it, all I had was just a little bit of a sore arm. I wouldn't even call it pain for about a day. I actually didn't have any other side effects. I didn't have any of the fatigue or the headache or sometimes the low-grade fever that some people are reporting. But if I had, I would have known that was just my immune system learning how to protect me. So everything went well this morning. I refer you to that if you'd like to see some more comments. Both of the CEOs of both Norwegian American Hospital and the Loretto Hospital spoke a lot about equity and about really making sure that we are doing everything we can to make this vaccine broadly available in Chicago and lowering barriers, especially in our community areas that have been hardest hit by COVID. And that has been parts of Chicago, especially that are predominantly Black and Latinx. So we are working now. There is enough vaccine broadly available across all of our inpatient hospitals. There's 35 of them in Chicago. So in addition to continuing to roll out first doses of vaccine, because 3 weeks ago, Chicago got 23,400 doses. Behind the scenes, we are getting the second 23,400 doses to the same hospitals in the same distribution so that all those healthcare workers that got vaccinated the first week will get their second dose this week, even as hospitals continue to vaccinate their own staff. We also broadly rolled out last week started with our outpatient healthcare workers. So I'm sure there will probably be some questions about that, but we've started distributing some vaccine directly to outpatient clinics that are seeing a lot of COVID patients, doing a lot of COVID testing, doing a lot of COVID diagnosing, and especially those that will go on to vaccinate in partnership with us here in Chicago. We also opened our first mass points of dispensing, mass vaccination clinics in Chicago last week. Those are only for outpatient healthcare workers, only by appointment. And the way it works is we've had more than 5,000 actually outpatient health practices fill out a form that is online. If you work for a health practice and you're still not sure about this, just make sure someone from your practice has filled out the survey. If you go to chicago.gov/coronavirus, right up at the top, there's a vaccine tab, and there's a special tab for healthcare providers. We're working to make sure that people who work in healthcare settings that won't be vaccinating in January, so whether that's dental offices or optometrist offices or our physical therapists, our home health aides, our morticians, our lab techs, everybody who's a healthcare worker, we are working to really make sure you get access to vaccine over January and February. So that's well underway. It's been going well. We also have gotten through most of our Chicago Fire Department, EMS, our paramedics, emergency medical services. We're going to be starting on the other emergency medical service paramedics and providers in the city, and then we'll continue along that path. We also last week started our long-term care facility vaccination. Really excited to get started with that. We know how hard hit our long-term care facilities have been, not just in Chicago, but around the country, with hospitalizations, with deaths, with a lot of illness, and that's true for residents. But we've also seen a lot of staff working in long-term care facilities get COVID as well. And so we're working in partnership with pharmacies to have strike teams, bringing teams into these long-term care facilities, again, making vaccine available to all residents and all staff, regardless of the type of job that they do in that facility. And we launched that last week. There's another, I believe, 43 long-term care facilities that are receiving some of their first vaccine this week, and we're continuing to ramp up from there. We actually have more than 250 of those facilities already scheduled here in Chicago, and there will be multiple visits to return there as well. So as we receive vaccine, we're working to push it out just as quickly as we can. We've actually distributed more than 95% of our doses here. We are hoping that production increases really at the federal level. These are newer vaccines. There's a lot of demand for them. We received this week in Chicago between 32 and 33,000 new doses of coronavirus vaccine. That means first doses. About half of those were Pfizer, about half of those were Moderna. And that's in addition to the second doses that we received for Pfizer. Those Moderna doses, for the most part, are being allocated towards these congregate living facilities. So long-term care first, but then also behavioral health or developmentally care facilities that help care for people with developmental disabilities, and we're working on through our other congregate settings. So it's been going well in terms of distribution. I really want to thank my team and all the people from across the city that are doing a ton of work related to making sure this vaccine is kept at the right temperature, that the records are well kept, that they're being followed well. All of the partners that we have in these healthcare settings that are doing a lot of the vaccinating. Hospitals have been that first initial partner, and they'll continue to be a partner, but increasingly our outpatient partners will come on board. We're bringing many pharmacies on board. The goal is to really have a lot of people able to vaccinate in Chicago. I expect to be in this 1A phase, which is the phase for healthcare workers and these long-term care and other congregate facilities here in Chicago, certainly through the whole month of January. And I don't expect it'll be February before we're able to move on from there, just with how much vaccine we're receiving. We also have just started to receive some of our earliest data back from the registry. So all COVID-19 vaccines go into the Illinois Immunization Registry. It's called iCare. And that information is kept very secure. So the only people who have access to that, you yourself have access to your vaccination record, your doctor or whoever gave your vaccine is able to check it, and then public health agencies are able to look. It's important that we keep track of which dose of vaccine you've gotten so that we can help follow up. If you need a second dose, make sure you're getting the same vaccine for your second dose. And generally, if there were to be any issues down the line, it's important that we know, of course, who's been vaccinated. And all of the safety data has looked very good across the country. There have been more than 4.5 million people who have already gotten that first dose of COVID vaccine. And though certainly, everybody wishes that were more, I think the rollout, for that many people has really gone quite well. So let's take a look at data because I want to have time to definitely get to your questions. So first of all, chicago.gov/coronavirus, right up at the top, latest data will get you to our dashboard. If we look overall on the dashboard, you can see first our positivity is ticking back up a little bit. We're at 10.2% today. Last week we were at 8.6%. You can see that here on the right here. That's the positivity just kicking up. Not surprised by this. This is related to really holiday, and it's as much about our dip in holiday testing as it is any major increase at this point in terms of cases. So if we look at our testing numbers, you see this is a 7-day rolling average. So this takes into account the whole sort of long weekend related to Christmas. Now we've had sort of a longer weekend somewhat related to New Year's. Major dips in testing that Thursday, Friday, Saturday, Sunday around Christmas, again over this last weekend. So you can see the 7-day rolling average is just over 10,000 tests per day, whereas a week ago we were averaging 15,000. So you can see that here, how far that's fallen off. And so in that setting, because positivity is number of positive tests divided by number of all tests, if your number of all tests has gone down a whole lot, your denominator goes down, it will make your positivity come up. So we're keeping an eye on this. You see that we saw a spike not just in positivity, but in cases after Thanksgiving. We'll see what that looks like after these end of year holidays. Our rolling average here is at 942, remains down 13% from a week ago. So that's reassuring. And generally our hospital numbers continue to head the right direction. Emergency department numbers look good. Our deaths, although they're still high compared to what they were over the summer, are trending down. We're averaging about 14 a day right now, down from 24, 25 at the peak. So Certainly want to thank everybody who made that difficult decision to stay home or just gather with your immediate family over these end-of-year holidays. I was just home over all of Christmas and all of New Year's. It's certainly not the way I typically spend those times, but I did Zoom and talk to people remotely, and had sort of a somewhat relaxed end of years, although we were also doing a lot of vaccine planning. So we'll certainly keep an eye on this. I don't expect these numbers to really even out for at least another week or so, and then we'll really have a sense of where we are. But generally, no major points of concern that I'm seeing in the data at this point. I also just wanted to show you where you can find some of this other information. So this is our just chicago.gov/coronavirus page. You see up at the top here, vaccine. This is the tab for all your vaccine questions. Like many of them are there. Just before doing Facebook Live, I was filming some of the frequently asked COVID questions answered. We're working to get those posted. So a lot of the questions that you may have, you can often find answered here. So I refer you here. Testing, we continue to update this every day or every week. A lot of testing capacity right now in Chicago. If you've got symptoms, if you've had an exposure to COVID, we don't want you to delay getting testing. There's information about there how to get tests sent to your house, information about Chicago's testing sites that we sponsor that are available completely. You don't need insurance, you don't need ID card. We've really made them as barrier-free as possible and placed them in the communities that are really being hit hardest. We do continue to run mobile operations there as well. You can see that. But really, first and foremost, check with your doctor. We are seeing more and more availability, and the FDA continues to approve additional tests. So there's more data there. If you want to see more on contact tracing, it's here. But under latest data, this is the dashboard, but coronavirus at a glance will get you sort of a more full view of where we've been over this outbreak. Hospital capacity, you can get details there. Data reports go into a lot more detail about different aspects related to outbreaks, et cetera. Our reopening metrics, our mobility report. Our data portal is where you can download the data if you want to explore it yourself. Presentations are things that we give at press conferences or others. There's the doubling time that we're following along with CPS. It's good. It's at over 80 days right now. Very confident about CPS's reopening. And then our vaccination data. So let's actually take a quick look at that vaccination data. When you click, you can see there's a number of different things here. And at the moment, this is what our cumulative doses per day look like. So what you can see, this goes through the 4th, and facilities are supposed to report within 24 hours. We are still, like I said, we just got some of this data back from the state, and we're working to clean it. There's still a few bugs in here. There's a few electronic health records that need some work to make sure the data is being fully collected. A few hospitals that's still not coming through automatically. Doing a lot of data cleaning and fixing. We are really excited to be able to have more data available really in the days to come. Obviously, we're interested in a lot of the race ethnicity data. We're interested in additional uptake. We do have more on there already about the zip codes of where the patients live. But for example, there were a number of places here in Chicago that were not appropriately collecting the patient's home address, and there were some sites that were reporting in some cases the address of the hospital where they were getting vaccinated or the clinic. So we're doing a lot of data cleaning. We really want to make sure that as we're sharing this data, it's as reflective as possible of the situation. But you can see here in Chicago, we're at 36,531 doses. Which is about 1.4% of Chicago's population. And the other thing we were able to see with this very early data download that, again, we'll be working to sort of get into our data sets over the next little bit here, was that 42% of the doses that we are giving in Chicago facilities are going to non-Chicago residents, which is fine because they work here in Chicago and we want them protected, of course. But these numbers that we report here, as you can see, are just for Chicago residents. And so we're going to work on how to show that as well. It's not that we lose any of those. It's why we're using this. We're all using the same state vaccine registry. But it does point to just the need for us to have a lot more vaccine available. Even if every dose that we were receiving right now was going into a Chicago resident, which we know it's not, it would take like a year and a half to be able to get through all of Chicago's residents just by population. So I'm very hopeful that production is going to ramp up soon and we'll be able to get more here. Okay, so let's turn to your questions. All right, so at C. Ritzum on Twitter, oh, this is about the doubling time. It says doubling time is what CPS is using as a safety metric. It's informed by CDPH. Why is positivity rate the main metric on the CDPH website, not doubling time? So it's been really, at this point, and I know there was a press conference also about CPS this morning, so I refer you to that if you have more questions there. Dr. Marielle Friccione from CDPH was there answering some of these questions. It's really been shown that positivity rate is not a metric that turns out to be particularly useful in terms of predicting whether it is safe for schools to be in session. We've seen that all over the country, all over the world, even here in Chicago, when good safety protocols are in place, it is absolutely possible for schools to be open, not driving community infection. The reason we're interested in doubling rate is that when you're seeing a high doubling rate, it means your outbreak is growing very, very quickly. When your outbreak is growing very quickly, it means there's a lot more operational burden on schools. There will be more people who are infected with COVID outside of schools who could potentially bring it in. Not that they're likely to spread it in schools, again, where you have good protocols in place, but it may mean there's more need to quarantine teachers, quarantine pods, and it can be fairly disruptive. So this is part of a larger national conversation, but we're not the only school district that's looking at this particular metric. And we do want to make sure that we're at a point really in the outbreak where we don't think having schools open is going to drive that outbreak, and we're definitely at that point here. I'm also very confident in all of the protocols that CPS has in place. And there's some things in place with CPS that we've actually not even had in place, even while a lot of the private and parochial schools have been open, and things like testing protocols, things like making sure there's been a industrial hygienist and an assessment of literally every teaching space, HEPA filters where they need to be, a ton of work to make sure that these sites really are as safe as possible. So I feel very confident in the reopening plan. Madeline Pearl on Twitter, when will CPS teachers have availability to the vaccine? Aren't they essential workers? Yes, so again, let me maybe just talk through where we are, because I think there's a lot of questions probably about this. So phase 1A, as determined by the CDC, the ACIP, is focused on healthcare workers and long-term care facility and these other congregate care facilities. So that's where we are right here in Chicago. We are a very long way from getting through our healthcare providers. Like I said, there's more than 5,000 practices here that have enrolled, and we need to make sure get vaccine over these next few weeks. So we will be moving to 1B as we start to see us having more vaccine available than people, to take it up within 1A, but that's not just yet. In 1B, educators are absolutely in 1B, in that next phase. Older Chicagoans, and then there's a specific list, and I refer you to the page if you're interested there, but it includes correctional settings, it includes first responders, it includes grocery store workers and manufacturing sites, places where we've had more of these significant outbreaks, and the postal workers, there's a short list, but educators are absolutely in there. And so we do intend to make vaccine available for anyone who is working in public facing settings. And so just as we will be working to make vaccine available for the CTA workers that are coming to work every day and running the buses and running the trains, we will be working to make vaccine available for all kinds of educators. This includes daycare, this includes K through 12, private, parochial, et cetera, for educators that are in person. Lisa Jericho on Facebook. Missed the morning press conference. Can you review the process for vaccination? So I hope if you've got a more specific question, maybe go ahead and put it in there. But what I would say is, so we'll move to 1B next, which will be these older Chicagoans. We will largely be encouraging older Chicagoans to get vaccinated through their healthcare providers. That's one of the reasons why 1A is so important. It's partly about getting the healthcare workers themselves vaccinated, of course. They're at some of the highest risk for COVID exposure in the city. But it's also that it helps us make sure that everything is in place, that these outpatient facilities have the vaccine, have the training, have all of their sort of paperwork done behind the scenes. We can check and make sure that their reporting is happening correctly into the registry. They have to fill out some federal paperwork so that as we hit 1B, we have a lot of availability. Our goal is that you, if you are an older Chicagoan right at the beginning of 1B, can go to your own doctor to get vaccinated, just like you would for a flu shot, just like you would for a tetanus shot, just like you would for any of the regular childhood vaccines. So part of 1A is also about getting all of that infrastructure built and all of that vaccine out to these vaccinating partners. So we've gotten started with that, but that will be part of it. We also will continue hosting the larger points of dispensing. We recognize that not everybody, of course, has a healthcare provider, and so you'll hear much more about this. But we've got a lot of work focused on what we call high COVID vulnerability index neighborhoods here in Chicago. There's an index that's used nationally that we've put some Chicago data into, so we know which neighborhoods are most likely to really need additional support to make sure that we're doing everything we can to lower barriers to vaccination. So just to give you an example, as we start to open up to older Chicagoans, it will open up at the same time to all older Chicagoans, but we'll be working to bring vaccine, for example, to maybe like independent senior living facilities in some of the neighborhoods that have been harder hit, that have higher COVID vulnerability, and that there may be more barriers to vaccine. So there's a lot more of this to talk about, and we'll be able to talk in some more detail. But 1B will be a combination of making it available through healthcare providers as well as pharmacies. We're working really hard now to get pharmacies enrolled. Yes, they will vaccinate their pharmacy staff, but they will also then be available to be vaccinators as we move into 1B. The other part of 1B are all of these essential workers, right, in all of these different categories like I was laying out. And we've been doing some analysis, how many are those of those work types are in Chicago, so that we can estimate distribution. And we will be working very hard to provide vaccine through employers where possible there. So we'll be making vaccine available through the CTA, right, or through CPS, or through any of the other large schools, through grocery stores. And we'll be pairing those employers with a vaccinating partner. So if they have occupational health, if they have nurses, in the cases of schools, for example, those are our most obvious vaccinating partners. Otherwise, we'll be working. And then again, we'll be sort of filling in gaps there, particularly in neighborhoods where we may see lower uptake or where we think there's support. We're thinking about everything from lowering, transportation, making sure people have rides if they need to get vaccine, messaging, but also just really setting up this huge infrastructure of rolling this vaccine out so we're ready. So 1B is kind of the jumpstart phase. It's these highest risk settings, finishing the congregate settings, some of these settings where we've really seen big outbreaks. It's the oldest Chicagoans who, of course, have had the highest risk for hospitalization and death. And then when we get to 1C, that's when it really opens broadly. It's all the other essential workers. So the ones that are not specifically called out in 1B. If you were in essential worker as defined federally, like back under stay at home, you're automatically in there. But at the same time, in addition to all those essential workers, 1C is when we open it up to anybody 16 to 64, or 16 and up, with underlying conditions. So, right, that's where we really see a major expansion, as well as any other older Chicagoans, who weren't reached in 1B. So that will be later, a little bit later in the spring. We're not through 1A yet. 1B, I expect probably February to kick in, kind of February, March-ish. To be in that time period, probably into sort of early spring. It all depends on how quickly we get vaccine. And then we'll open to 1C. And that will be when it's a major expansion of who can get vaccine. And that's it in terms of phases. After 1C, we're just in phase 2, which is everybody, available to all comers. I don't expect us to be in phase 2 probably until the summer at this rate. But once we hit 1C, hopefully there will have been a lot more vaccine production, and we'll have this very good infrastructure built to be able to make vaccine available as easily as possible for everybody in Chicago, putting extra emphasis and work to lower barriers in neighborhoods that have been hardest hit. So that's the high level. The only exception to that is children. You heard me say age 16 and up. That's because the vaccine has not yet been approved for children. Pfizer was approved for 16 and up, and Moderna was approved for 18 and up. That's because that's the age the trials have been done in. Trials are getting going now for age 12 to 17. In fact, there were a few in that age group that were in the original Pfizer trial, but we need more data there. And then there will need to be another level. They'll probably go, if I had to guess, 6 to 12 after that, and then maybe even younger. Children's immune systems are really pretty different than adults, and they evolve. So infants have very different immune systems than teenagers do. And as always, our top priority is that any vaccine is safe and effective. So these studies have to be done in kids. They may need different dosing, for example, right? All adults are getting the same dose of COVID vaccine at that point, and that's how the trials were done. But especially younger children, you may need a lower dose. You need to understand what that response is. And just given how differently COVID has behaved in children, we want to be, especially careful to make sure that there aren't any of these inflammatory concerns, et cetera. So I know people are impatient to have kids vaccinated, as am I. But the first approach is really to make sure that all of the trials are done safely. That won't be rushed, just as it was not rushed for adults. All of the exact same safety protocols in place as have been required for any of our regular vaccines. That's why I have such strong confidence in the safety of it. So I don't think there's going to be vaccine available for kids till really quite a bit later in 2021. I think probably even that next level down, the sort of middle school, high school kids, will probably be this summer. And time will tell. I can't know for sure, but the trials need to be done, and vaccine needs to be available. So that's where we are, and that timeline will continue to evolve as we learn more. Shaw PD on Twitter. Okay, there's a number of people here. Shaw PD on Twitter, Linda Flanagan on Facebook, and Maureen Linden on Facebook, all asking about how does Chicagoans sign up for a registry to be notified? How do we get notified when it's our turn? When can seniors get a vaccine? Is there a sign-up list? So those of you who use Chai COVID Coach back when we initially launched this, we've kept track of that there is the ability for us to let people know. We have not at this point turned on and as I know some other counties have, we've not turned on a general registration for COVID vaccine yet. We may do that. We may end up linking it back to some of that original COVID Coach or sort of having a separate registry. But what we didn't want to do is create confusion. And we already know that there are people, we know people are anxious to get the vaccine, but there is not vaccine yet available for most Chicagoans. So healthcare workers, yes, there is a process, as I said at the beginning. They register through their employer, through their practice, and we're hard at work on those. There were more than 115,000 that had been registered last I looked at that, and we're working on getting them vaccine. As we start to move ahead here, there will be the opportunity for you to get vaccine, but I don't want you to worry that because you haven't signed up somewhere, in any way you're behind or you're not hearing about it. Again, most people are going to be vaccinated through their healthcare provider, and we'll be asking healthcare providers to actually, once we start to move ahead here, be reaching out to their people who are oldest or at the highest risk for COVID to help make appointments. And then we will be setting up opportunities for people to, to be able to sign on to get vaccine as it is available to them. But this is months away, and I know it can be frustrating if you've signed up and then you're waiting and you're waiting and you're waiting. So more to come on this, but at the moment we remain focused really on healthcare and on all of these congregate settings, of which there are hundreds and hundreds in Chicago. So I will certainly keep you updated as progress continues to evolve there, but we think that's the best practice, looking at how this is being done around the country. Nancy Gutierrez on Facebook. What if I didn't think I had COVID-19 at the time I took the vaccine, but I did? What effects would it have? All right. So first of all, if you think you have COVID-19, please don't come get a vaccine at that point. It really just has as much to do with infection control as anything. We don't want people who have symptoms really in our vaccinating clinics, although of course we're doing all the appropriate social distancing and masking. If you were to have COVID at the time of getting the vaccine, I don't anticipate there to be a problem with that. What you're kind of doing though is giving your immune system an extra boost at the exact time that the natural infection would sort of be boosting your immune system. system. I suppose there's some theoretical consideration there that you could like have a little bit more immune response than you might have otherwise. You could get a little sicker. It's really not fully predictable. We don't want people to certainly get vaccinated if they've just had COVID, if they have COVID right now, or in the 10 days past their, while they're considered infectious with COVID. That's not the time to get vaccinated. We do know there's some level probably of protection. CDC, after you've had natural COVID infection, CDC estimates that may last sort of up to 3 months, but it's not that predictable. So if you've had COVID and recovered, we do want you to get the vaccine. That includes even if you've had an antibody test, you think you're protected. There's a lot of different types of antibodies. Those tests are not for the neutralizing antibodies. And more importantly, people who have had maybe a very mild COVID infection won't have mounted as significant an immune response. And on the other end of the spectrum, there are some people who got really sick with COVID, whose immune systems were overwhelmed. They may not have as much of an immune memory response. The vaccine's goal is to really give a predictable immune response that can be measured and followed, and hopefully is more enduring. It can last longer than the underlying COVID infection. So bottom line, you should plan to get a COVID vaccine even if you've recovered from COVID-19. The vaccine cannot give you COVID-19. It is completely impossible. But if you were to have it at the same time, I wouldn't anticipate there to be any major side effects. Richard Benson from Facebook. Oh, thank you, Richard. He says, I'm happy to be part of the Ensemble True trial for the Janssen and Johnson & Johnson vaccine. Are other trials ongoing in Chicago, or are they mostly done? And how can people get involved and sign up for trials? So thank you so much for volunteering to be part of a vaccine trial, and particularly, yes, these vaccine trials that are very much still ongoing. In addition to the Pfizer and Moderna vaccine trials, which are actually not over, they're continuing to follow people over time in those trials. There are additional trials that are ongoing. AstraZeneca is ongoing, Johnson & Johnson, there's a Merck, there's a number of them. And so we absolutely would encourage people in Chicago, if you're feeling anxious about not having been able to get one of the approved vaccines yet, particularly, if you're in one of those later groups, I would love for you to think about signing up for a trial. As we get these trials enrolled, this is how, one of the reasons we were able to bring this vaccine to production relatively quickly is there was a high interest in volunteering for these COVID-19 vaccine trials. Enrollment was very fast, and they worked to make sure that it was quite representative in terms of making sure race, ethnicity, age, underlying conditions were all represented in the trials. So we will post the website for signing up for the vaccine trial. Can you put that in the comments? Because I want to give the one that's general for all of the COVID vaccine trials. I just don't remember it off the top of my head, but we'll put it in the comments, and I'll make sure it's available on our website as well, and we'll point to it the next time. So yes, please consider signing up for trials, and to the many of you that have been part of getting us this far, thank you, and we are not done. More vaccine approval will be really good news for us being able to get more and more Chicagoans vaccinated. Oh, perfect. There it is. Thank you. www.coronaviruspreventionnetwork.org. So www.coronaviruspreventionnetwork.org. That you sign up on there, and it links you to all of the ongoing vaccine studies. It actually also links you to some of the other clinical medical studies. And so that is your first step. And then if people are interested in enrolling you, they will reach out. Especially, again, if you are in one of the harder hit communities, Black or Latinx, if you're a frontline healthcare worker, etc. Well, the frontline healthcare workers now should have been vaccinated, but besides that, would really encourage you to be part of the trial. G. Wilma Rodriguez from Facebook. Does the current vaccine work on the South African strain? Okay. The vaccines that we have available work on every strain of vaccine that exists in the world today that we know of. And every time there is a slightly new strain that is uncovered, it's not unexpected to see this virus changing. In a lot of ways, it's actually had some fewer changes and mutations than I might have expected, because there's not been a lot of evolutionary pressure on it to have to mutate, because it's been so successful as is. But yes, one of the really important things to know is that the UK strain or any of these other strains people may or may not be referencing, They're all being tested against the current vaccines that have been authorized for use, as well as all of the vaccines that are still in trials and coming along behind those. And at this point, there's been no sign that any of those strains that the vaccine would not protect against any of those strains. That's the most important news about them. So, good question. Stephen Mitchell was asking about, will there be a vaccine for children? If so, when? As I said earlier, not till later in 2021. I'm guessing it'll be summer before the earliest vaccine for children is available, and that may not be the youngest, even if those trials aren't done. So it's a watch this space, and certainly we'll learn more over the next few months. But we got to make sure that this vaccine is safe and effective for children before the FDA will authorize it, and certainly before I would recommend it. Let's see. Sam Martin from Facebook. Oh, what about just giving the first dose and delaying the second dose? Okay, so there's also been a lot of conversation about, are there ways to stretch the current vaccine availability? And in the UK, where, by the way, they do not have access to the Moderna vaccine, they've only had the Pfizer vaccine and then just recently approved the AstraZeneca vaccine. They are working very hard to really push out the first dose and kind of waiting a little bit to see about the second dose. At the moment here in Chicago, we are absolutely 100% following the FDA and the CDC guidance and actually requirements in terms of how this vaccine is administered. We will not make any changes to that recommended dosing protocol unless the FDA and the CDC through the ACIP were to make that recommendation. Where the question is coming from is that, and there's been a number of different theories about this. Like, there seems to be some level of, there is some level of protection after that first dose. Maybe we should just do that and sort of, defer the second dose given the desire for vaccine. There's another version of this question where people are saying, maybe we could just give half a dose of vaccine and sort of see. The problem is these vaccines have been tested for safety and efficacy using a particular protocol. And there is some ongoing work to see, is it possible to potentially, think about using a lower dose or a one-dose regimen? But the Pfizer vaccine, for example, when that first data was released, Pfizer itself said you're only considered protected 52% after the first dose, and that 95% protection came after the second dose. So I do not want to sort of be banking that 52%, for example, is kind of enough. And these were all tested with the initial immune response as well as that booster shot coming, a certain amount of time after it. Might there be some possibility for spacing that booster shot out? There might be. But the trials have been done the way the trials have been done, and we will be sticking, and I would strongly recommend that really any public health agency do stick to what has been approved. That's how we know vaccines are safe and effective. We know that the trials have been done in the way that they've been given. If the science is done that shows there may be additional ways to do this, we'll be the first to look at some of those protocols. But right now, first dose and second dose for everybody on the time schedule that's recommended. Great question, though. All right. We're still getting multiple questions about, I'm a healthcare worker and how can I register? So chicago.gov/corona, I'm just going to show you. Chicago.gov/coronavirus. You go right up at the top here to vaccine. And then, first of all, on the vaccine page, there's FAQs, everything else. But see this healthcare providers right here, or up at the top here, healthcare providers, you link there. And it explains all about how to do this, how healthcare workers can make vaccine appointments. One representative from your facility must complete the staff vaccination inquiry survey. That's the link. It brings you to a behind-the-scenes survey. That's what we've received more than 5,000 of from healthcare, outpatient healthcare facilities here in Chicago. One representative from your facility needs to do this. We're working by facility to make sure that everybody who works at your practice, whether it's a practice of one or a practice of hundreds, gets access to vaccine. So that's what you need to do. And then as you can see, once providers have completed the survey, we're working to figure out how to either get you a vaccine or register you for an appointment. And then the facility gets a registration code that's distributed to the facility. So for example, we say, dental office X, you're good to go. Here's your code. You've told us you have 25 employees. There are 25 slots available to you in any of a variety of sites where vaccine is available. And then you individually with that code are able to sign up for the day and time that makes sense for you. So that is how it's working. And we are overwhelmed right now in terms of people looking for vaccine, which makes me happy. So I'm glad people are looking for vaccine. We are making it available, again, just as quickly as we can. As our hospitals are starting to get through their inpatient staff, we've asked them to go back, do a second round. We're not seeing full uptake there in those settings, and I want to make sure that all the healthcare workers associated with hospitals are getting vaccine, right? Not just the doctors and nurses, but the people working in environmental services or dietary or any of the other ancillary services. They also should be offered and should be receiving vaccine at this point. But then we'll be looking to them to really partner with outpatient providers. So we you know, if there are clinics that refer to them, if there are students, residents, and others, most of them have already been vaccinated. But if not, really looking to those hospitals to help partner with us to get all of these outpatient providers vaccinated. So that's the system that we have in place now. There's a separate system that's happening for all of our congregate facilities that we've been arranging more strike teams. These, again, are settings where it's hard for people to leave to get vaccine, so we need to bring vaccine to them. And that is also going very well. All right, I think we are at time. So let me just see. If we didn't get to your question today, again, we're recording a lot of the frequently asked questions and posting them. So do check out the website. I love getting your questions, actually. It's very helpful for me to see what people are wondering about and how we can work some more on messaging. I also wanted to mention, we have posted it on social media and on the website, but Thursday at 6 p.m.? It's either 6 or 6:30. We've posted it. There's a really large national teaching session about what Black Americans need to know about the COVID vaccine. They've got all of the national leaders, whether that's Dr. Fauci or the CDC leaders, the African American doctor who really led a lot of the Moderna production at the National Institutes of Health, many Black leaders really nationally from around the country. Dr. Helene Gale from the Chicago Community Trust will be in this group. It looks to be really good, and I would strongly encourage everybody to watch this, but especially if you're Black or you have questions. It's at 7?
Sorry, 7. On Thursday.
7 Eastern, I think.
So 6 here.
Yeah, 6 p.m. here. 6 to 7:30 p.m. And it's going to be on Facebook. It's on a couple of platforms. Again, look to our social media for some more details, but I did want to highlight that because I think it's going to be good. Other good news, of course, second doses beginning in Chicago is our really good news. That means we've got our very first people starting to get to the point where they would have that 95% protection. And then just as one more note on a thing to do, post-holidays, those of you who might have been celebrating Christmas and had a Christmas tree, which I did not have time to have a Christmas tree myself this year, but if you did, Merry Christmas. You can recycle that tree. There are 24 parks, Chicago parks, that are accepting trees. That starts Saturday, January 9th, this Saturday, so go to recyclebycity.com. That's recyclebycity.com to see more information, and please do recycle your tree instead of throwing it out. And other than that, keep doing the things you're doing. We are making pretty good progress here, broadly, I think, in terms of seeing our numbers and our positivity go down. If I looked at the data over the weekend, and Illinois was 34th out of 50 states in terms of our number of cases per 100,000 population. That's how we compare across states. You want to be lower on that list. So way at the bottom is Hawaii. They continue to really have the best controlled outbreak. It helps to be an island. But we were 34th, which is some good progress there. And actually, if Chicago were a state over the weekend, we would have been 45th. So we really are doing much much better. We're still not quite to where we want to be on either our positivity or our cases, but heading the right way. I'm hoping really over the next week we're going to see where this post-holiday bump takes us, but it's nothing very alarming to me right now. And I'm really feeling excited about hopefully being able to move ahead, not just related to vaccines, which of course is the big way that we are starting to move ahead here, but even in terms of hopefully being able to think about some reopening, whether that's Chicago Public Schools, in this carefully phased way, but also, I'm hopeful that perhaps later this month, if we get past this and everything is looking better, we may be able to really start on some more reopening of businesses, because I know how hard this has been, on everybody, but especially for businesses and especially for small businesses here in Chicago. So keep doing those things that know work. If vaccine is available to you, if you work in a hospital setting, there should be vaccine available to you right now, and I want you to please take advantage and get vaccinated now. If you are in a long-term care facility, or you have a loved one in a long-term care facility, or you work in a long-term care facility, please take that vaccine when the strike teams come. We're not going to be able to come back forever and ever. And in terms of being able to really protect our most vulnerable people, it is crucial that we see good uptake there. We'll be doing some additional educational events related to long-term care facilities over the next couple of days. And I believe we're planning a press conference related to long-term care also nearer to the end of the week. So you'll be hearing some more about that. Those outpatient healthcare workers, we're getting to you, we hear you, and are rolling it out just as fast as we can. And everybody else, I know it's hard to wait, but I would really ask you to use this time to educate yourself about the vaccine, talk about the vaccine. We are not seeing equal uptake of vaccine across neighborhoods or across worker types. And although that is at some level to be expected, I really want us to defy those odds. I want to see good, equitable access and uptake of vaccine here. That's not going to happen by accident. So you'll be hearing a lot more about all of this in the days and weeks to come, but I am very pleased with how this rollout has been going operationally so far, and we will continue to share more information and data as we're getting it and able to clean it and make it available, and think of this as a way to get past COVID. But in the meantime, wear your mask, socially distance. Don't start thinking that because we're talking about vaccine or our numbers are going down that we're done with COVID, because we're not. But we're doing pretty well here in Chicago. We're on the right track, and I am hopeful that this will be not just a good year, but even a good month or two here. So thanks very much for everything you're doing, and we will see you back on Thursday, right? Regular time at 11 a.m. Answer more of your questions. Thanks.